epinephrine and norepinephrine hormones are released from adrenal, suprarenal glands. These are two glands that sit above kidneys. When we look at each adrenal gland, we see that it has a shape that looks like a pyramid. There is a capsule surrounding the adrenal gland. The inner central part of adrenal gland is referred to as adrenal medulla. The outer part of adrenal gland is referred to as adrenal cortex. Inside the adrenal medulla, we have some cells that they produce hormones, and we call these cells chromaffin cells. And it is important to note that hormones such as epinephrine, or we can say adrenaline, norepinephrine, noradrenaline, are released from cells in adrenal medulla. Epinephrine and norepinephrine reinforce the impact of sympathetic division. So it is not surprising that when we are in a fight or flight situation, which is described as a stressful situation, a situation that we need to use more energy, an emergency situation, that's the moment that basically the nervous system stimulates more secretion of epinephrine and norepinephrine from adrenal medulla. When we look at the nervous system, we see that those nerves that exit the central nervous system and stimulate adrenal medulla for more secretion of epinephrine and norepinephrine are some of the thoracic spinal nerves. And then cells in adrenal medulla secrete these two molecules into the interstitial fluid, and then from interstitial fluid, epinephrine and norepinephrine get into bloodstream. So that would be blood that transports these molecules to different organs, different regions of our body. And we know the rule is when secretion of cells is transported by bloodstream, those secretions must be referred to as hormones. So epinephrine and norepinephrine released from adrenal medulla are two hormones, but it is important to note that there is an unequal amount of these two hormones released from adrenal medulla. 80% would be epinephrine and only 20% would be norepinephrine. One of the organs that blood takes epinephrine and norepinephrine to would be heart. Epinephrine and norepinephrine increase both heart rate and the forcefulness of muscle contraction, myocardial contractility. And we know, especially in ventricles, when the contraction becomes more forceful, ventricles pump more volume of blood out each time that they contract. That would be an increased stroke volume. So the conclusion is epinephrine and norepinephrine, by increasing both heart rate and stroke volume, successfully increase cardiac output, the amount of blood that ventricles pump out into the arteries in 1 minute. And when cardiac output increases, one result would be an increased blood pressure. So epinephrine and norepinephrine increase the blood pressure by increasing the cardiac output. And it is absolutely necessary that blood pressure increases during a fight or flight situation because that increases blood flow. We want to make sure that especially the critical organs that we have receive enough volume of blood in a shorter period of time. Speaking of critical versus non-critical organs, we know that organs such as skin, abdominal viscera, and kidneys are considered non-critical organs in a fight or flight situation. So when epinephrine and norepinephrine hormones get to skin, abdominal viscera, and kidneys, what they do, they make the blood vessels in these regions to constrict, to narrow down. And that should make sense because when we say that they are non-critical, it means that we want to send less blood to these non-critical organs to have more blood for the critical ones. But here we need to note one by one what happens when arterioles and veins constrict, narrow down in skin, abdominal viscera, and kidneys. Recall, arterioles are those very narrow arteries that branch off and form capillaries to supply basically tissues with oxygenated blood. When arterioles in these non-critical organs constrict, the result would be increasing systemic vascular resistance. And we know when systemic vascular resistance increases, that's one scientific explanation for increasing the blood pressure. And when veins in these organs constrict, basically the muscles that we have in the wall of these veins contract. They help these veins to push their blood back up toward the right atrium. That simply means the volume of blood that veins send back up to the heart would increase. Venous return increases, and when venous return increases, the result would be increasing cardiac output and blood pressure. So there are different strategies used to make sure that blood pressure increases during fight or flight situation, and that would definitely help to increase blood flow to some critical organs such as heart, skeletal muscles. We also notice that we need more blood flow through structures such as liver and fat tissue. In case the question is why liver and fat tissue, let's note that liver cells and fat cells, adipocytes, store nutrient molecule. And when we are in an emergency situation that our cells are in need of nutrients, we expect liver cells and these fat cells to break down the molecules that they store. Recall, liver cells store, for example, glycogen and triglyceride. Adipocytes store triglyceride. This is the time that they need to break down those molecules and release glucose and fatty acid molecules into the bloodstream. So that would be another impact of epinephrine and norepinephrine to increase blood level of nutrients such as glucose and fatty acid.